Hello, my name is Robert Shingleton, and welcome to my presentation on cognitive behavioral therapy, or CBT. In this presentation, we will explore what CBT is, its history and development, and the theories that support it. We will look at how CBT views mental illness, what it does in practice, its strengths and limitations, and the critical role social workers play when applying CBT with clients. We will also examine the evidence base for CBT, demonstrating why it is widely used and effective in mental health settings. So sit back, relax, and enjoy as we dive into the principles, practice, and impact of cognitive behavioral therapy in mental health and substance use disorders. Cognitive behavioral therapy or CBT is a widely used evidence-based psychosocial intervention in mental health, as one line on the slide to reinforce context. Cognitive behavioral therapy is a structured and goal-oriented intervention. It focuses on connection between thoughts, feelings, and behaviors. CBT equips clients with practical skills to identify and modify distorted thinking patterns, build coping strategies, and take action to change behaviors that interfere with mental health and recovery. CBT is not just theoretical. It equips clients with practical skills to manage thoughts, emotions, and behaviors, including preventing relapse. CBT was developed in the 1960s by Aaron Beck. He was building on cognitive and behavioral therapies. It was initially applied to depression, but has since expanded to treat anxiety, trauma, and substance use disorders. Over time, CBT has become one of the most widely used evidence-based psychosocial interventions in mental health and addiction. It became widely adopted due to its evidence and measurable outcomes, helped CBT become standard in treatment. CBT integrates cognitive and behavioral theories. Cognitive theory emphasizes that thoughts shape feelings and behaviors, while behavioral theory shows that behaviors are learned and reinforced by environmental factors. CBT also teaches practical coping and problem-solving skills and builds self-efficacy so clients gain confidence in their ability to manage challenges. These principles guide social workers in teaching clients strategies to modify maladaptive thoughts and behaviors effectively. CBT views mental illness through a biopsychosocial lens, considering biological, psychological, and social factors. It targets maladaptive thought patterns and behaviors rather than labeling the person. Mental health challenges are treatable through skill development, and CBT emphasizes client strengths and empowerment in alignment with NASW ethical principles. By targeting thoughts and behaviors, CBT empowers clients to prevent relapse and strengthen coping strategies. For example, a client might think, I can't cope, so I'll use drugs. But CBT helps reframe this to, this is hard, but I can use healthier coping skills, which supports recovery and prevents relapse. So applying CBT teaches clients to first acknowledge their thinking error, allowing clients to begin a paradigm shift. Instead of dropping into an all or nothing mindset or taking things personally, CBT helps them step back and evaluate the situation more objectively. From there, they can shift towards thoughts and behaviors that improve outcomes and increase the probability of success. Rather than reinforcing patterns that led to relapse or distress, really rewiring behaviors. CBT helps clients identify distorted thoughts and cognitive errors, learn coping strategies, and practice behavior change. By reinforcing adaptive behaviors, CBT improves emotional regulation and decision making. It is applicable across a range of mental health conditions, including depression, anxiety, trauma, and substance use disorders. One example of CBT in practice is its use in relapse prevention. Clients learn to identify high risk situations, recognize distorted thoughts such as rationalization or minimization, and reframe these thoughts. They practice coping strategies and behavioral planning to prevent relapse. This shows how CBT can be applied in real world mental health and addiction treatment. By addressing these thoughts and planning alternative behaviors, clients reduce both the mental stress and physical risk associated with relapse. And CBT is evidence based, practical, and teaches clients real world skills that they can use immediately. It is adaptable across mental health settings. However, CBT requires client motivation, and for some individuals with severe or complex trauma, CBT may need to be combined with other interventions. CBT's short term and structured nature is a strength for measurable outcomes, but might require integration with trauma informed approaches for deep trauma cases. See, social workers use CBT by assessing client needs, teaching cognitive and behavioral strategies, supporting goal setting, and guiding behavioral practice. They also ensure that interventions align with NASW ethics, emphasizing client dignity, empowerment, and advocacy. Social workers also monitor progress and adapt CBT techniques to meet individual client needs, ensuring culturally competent and client centered cares. CBT has a strong evidence based research shows it reduces symptoms of depression, anxiety, trauma, substance use, and improving coping skills. It is recommended in clinical practice guidelines as a first line psychosocial intervention. And studies show CBT can reduce relapse rates by up to 30% in substance use populations. These two sources provide strong evidence for the use of CBT in mental health. Beck's 2011 book demonstrates how CBT principles, including identifying distorted thoughts, teaching coping strategies, and modifying behaviors, are applied specifically to substance use and relapse prevention. It shows the theoretical foundation and practical exercises that social workers can use with clients. McHugh, Heron, and Otto's 2010 peer-reviewed article confirms that CBT is effective across multiple mental health conditions, including depression, anxiety, and even substance use disorders. The research shows measurable outcomes, such as reduced relapse rates and improved coping skills, demonstrating why CBT is considered an evidence-based intervention in clinical guidelines. Together, these sources confirm both the theoretical basis and real-world effectiveness of CBT. Supporting the approaches and strategies outlined in the presentation, these sources ensure that this presentation reflects evidence-based practice, a key requirement in social work interventions. And I'm Robert Shington, and thank you for watching this presentation on cognitive behavioral therapy. Understanding CBT's principles, applications, and evidence equips social workers to support clients effectively in diverse mental health settings. I appreciate your time and attention. CBT is evidence-based, practical, and empowering approach that social workers can use to support mental health and relapse prevention. So please like, subscribe, and share.